This is a video for topical anesthetic placement for anesthetic injections. And the first tooth we're going to do here is tooth number 9. And we need to do an infiltration, a field block, and a palatal injection. And this is part of the ASA, or the anterior superior alveolar block, and the nasopalatine block as well. So first off, we're going to do the infiltration, which starts off right here in this area. And this is usually the first injection, so we will place our topical in this area, right here. That's for infiltration. And then field block is going to be a little higher up and a little moving towards the back a little bit. So towards this area here. And that's, signaling that. So after we do that, we need to do the nasopalatine injection as well. And that is going to be, we don't want to inject right here, like directly on this. We want to do it beside that. And we're going to do it on this side since we want to numb this tooth here. And this, it is going to run a little past this way, but regardless, it's going to be at this side. So it's going to be right here in this area for the nasopalatine injection. We're also going to be doing tooth number 14 the same way we did tooth number 9. We're going to do infiltration, field block, and palatal injection. And that tooth is part of the PSA, posterior superior alveolar block, and which is the posterior part of the mouth, these teeth back here. And we're going to do a palatine injection, but it's going to be the greater palatine injection, which is farther back. So to start the infiltration, it's going to be, for this tooth, is going to be right here. So we put our topical anesthetic right here in this area. And the field block is going to be higher up and back as well, but, so it would be here, behind this right here. So behind that. So that would be our field block for tooth number 14. And so the palatal injection, so that would be this tooth right here. This nerve here, that's where we don't want to, inject directly on it. So we're going to do kind of here in this area, for this tooth right here. So it'll block like this whole thing right here, this whole area, including that tooth. Now we're also going to do the topical placement for tooth number 18, and we're going to do a mandibular block, or an IA block, inferior alveolar nerve block, and a buccal block next to that. But first, the IA block goes right here in this area. And the direction is also kind of how it is here, the Q-tip kind of this way. And the buccal block is beside that, and it's going to be here in this area. So the topical anesthetic would go in this area. And now we're going to do the infiltration. So if I scroll up here, infiltration for this tooth number 18, the one in the back, would be here. So the topical would be placed right here for that infiltration. And then we also have to do the lingual injection, which would be here as well, in this area, for this tooth, 18. Okay, so our next tooth is number 25, and we're going to need to block this area here of the incisors, and that's going to be using our IN block in order to block this section right here, and including that tooth number 25. So how we're going to do that is using our mental nerve block, which, how I learned in the past, it's in this area right here, and you need to put pressure in order to numb those teeth. So topical will go here, and then the injection pressure in order to numb this area as well. That's for our iron block, or our incisive block, how we call it, on the buccal side of the teeth. And we also need to do an infiltration for that teeth as well, and it's going to be around here, right here, around this, for that tooth. And we also need to do a lingual block there. So if you go down to our lingual side, tooth number 25 is here. That's one of our central incisors, and then we're going to do a lingual injection for that tooth. So now we're going to be doing tooth number 28, and we're going to do a mandibular block, another AI block for this tooth, because this block is, well, it's going to be placed right here, and this one numbs this area and half of the tongue and the tissues facial to the premolars as well. Okay, so that's the IA, and then the other one we need to do is also infiltration for this tooth, which is, it's this one, number 28. So infiltration would be here in this area. Topical would go there. And then we also need to do a lingual injection. Where's the lingual? Okay, lingual injection for this tooth, number 28, right here, lingual. Followed by, because apparently this patient is having a hard time getting numb, a PDL is the 6 sites for the injection. We have, this is, I'm going to do the buccal site on this one, and then the lingual site on this one. And it's mesial, buccal. I hope I'm saying that right. Yeah, mesial buccal. And then in the center, and then distal buccal. And that's, for the buccal side. And then the lingual side, you would go, down, and then in the same tooth, in the same area, like this. So there are 6 in total, 3 on each side. And it is around the neck of the tooth per se, at, the gum line, injecting straight down. And last but not least, we have to do we'll demonstrate once again the nasopalatine and the greater palatine blocks. Similar to, it's the same idea, but on the other side. I'm just gonna show the other side as well. And depending on which side you do it, it's more specific to this area, as this one is more specific to this area. And for the greater palatine as well, it'll be here for the greater palatine, and it'll be to numb obviously this side of the mouth as opposed to this one. And yeah, that's it.